Hi guys. Assalamualaikum. Good morning. Selamat pagi. Dengar tak
Good
ni?
morning, Doctor.
Speaker. Den. Okay. Baru 40 orang. Do you have exam today? Or test? Okay, that's good. Yeah, where's everybody then? Still sleeping. Semalam kira mulai kot ni. Dah masuk malam 10. Okay, while waiting for other students, do you have any questions or anything at all? Or comments or discussion or whatever? Or you want me to ask question? Let's call some names. Okay, I've uploaded today's lecture notes in Putra Blast as well. You can refer to the Putra Blast. It's just that I haven't, what do you call it, write your test exam yet for test one. I'm still contemplating whether I want to include today's lecture into the test or not. Because if I don't include it, then it's going to be in test two. And then test two is going to be quite a lot of topics. I'm afraid you will fail test two. Because the percentage for test two is much higher than test one. So usually students score test one. It's quite easy. Yeah. Okay, half of your class. I'm supposed to have a meeting today actually. You hear me? Okay. 64, where's the rest?
Oh, hello. Are you there?
Oh, that's in it properly.
I like it. I love it. I want some more.
Okay, let's get started then. Okay. JJ has booked the auditorium for Monday. Okay. I think we'll start the exam at 8:30 lah kot. It might be 1.5 hour, 1 hour or 1.5 hour. So just get ready lah. See, there's gonna be some images on the screen as well. I need to check whether the screen is okay because they are using it for. Okay, okay. First of all, morning, assalamualaikum, selamat pagi, salam sejahtera. You have any question on anything at all before I start? If not, so we are done with what call it is respiratory diseases. So we are going to start with neuro diseases with nervous signs. Okay, there are several diseases that can show nervous signs. Okay, including Newcastle disease, avian influenza, and then many more. Okay, even fall cholera and whatnot. So, but I'm listed here some of the common diseases that showing clinical signs that I'm going to include in this lecture. But you have to include, you have to bear in mind that some of other diseases can also have some neurological signs. Okay. So the first disease is avian encephalomyelitis, or also known as epidemic tremors. It's a viral infection of chickens, turkeys, pigeons, and quails. Okay, it leads to progressing ataxia, and then eventually it leads to paralysis and tremors of the head and the neck. So this disease are of worldwide distribution. So basically, you'll see it almost like in any continents or every country have this kind of problem. Clinical disease is low unless breeder is not vaccinated. Honestly, personally, I have not seen this disease, but as expected in few cases. Okay, because if the breeder is vaccinated against it, usually you don't see much in the broiler. Okay, clinical outbreak usually observed in 1 to 3 weeks old chickens, and in older birds usually there is not much clinical signs. So that's why in broiler you don't see much of this disease anymore because most of the breeder are vaccinated against avian encephalomyelitis. Okay. And then the etiology is a Picorna viridae, single-stranded RNA. There is no serologic difference between isolates. So basically it's off like one serotype kind of things. Okay. So vaccines kind of quite working well because there is not much variation, okay, on serologic and immunogenicity. Okay. And the transmission is through vertical and horizontal transmission. In feces, virus can survive for at least 4 weeks. Clinical signs for this disease, in chicks, you might see at hatch, but usually between 1 to 3 weeks old. They basically look dull and then showing neurological signs. Ataxia progressing to paralysis, prostration, loss of balance, and paralysis, like total paralysis of the birds. Okay. And then you might see tremors of the head and the neck. So it's like it's shaking like that. Okay. Mortality in clinically affected birds is up to 25%. Morbidity may exceed 50%. Chicks, chicks that survive often fail to grow or produce eggs normally, and many survivors later develop bluish opacity of the eye, lens, and impaired vision. So this is one of the unique signs of this disease. Later on, those chickens that was infected early, and then they survive, and then they develop some this bluish opacity opacity of the lens. So you have to differentiate this with Marek disease, with if I will explain in later on in the same topic of neurological disease also. That one, the Marek disease can cause grayish discoloration, but that one is on the iris. Okay, this one is on the lens. Okay, in adults, you'll see transient decline of egg production. Okay, so it's like sudden drop for a while, for about 2 weeks, and then it goes back to normal. Mark age resistance to clinical sign if exposed after 2-3 weeks of age. So basically, those adults are somehow resistant to this disease. So you'll see this in chicks. So this is how they look like. Progressive ataxia paralysis. So they just paralyzed. Dia tak bergerak. So banyak. So they just pedaling on the floor. Okay. This one shows some sign of torticollis. Okay. And bluish opacity of the lens. This is how they look like. Okay. This is the lens. Yang tengah ni lens. Okay. The middle here is the lens. So bluish discoloration. This is a normal color of the eye. Okay. If you do postmortem, generally there is no lesions. You don't expect to see much lesions. Okay. Except a little bit in cheeks, you will see whitish musculature of the gizzard. The gizzard becomes like somehow white in color. Okay. The histology, if you do histology of the brain, okay, you might see prevascular cuffing. I think you are familiar with prevascular cuffing, right? Okay, you should have been taught in pathology. Swelling and chromatolysis of the neurons, and then lymphoid aggregates in the muscle of the proventriculus and all gizzard and myocardium and pancreas. So, like I say here, the whitish area of the gizzard, this is the gizzard pedal. Okay, pedal, it become whitish. Okay, there's some whitish discoloration here. Okay, due to infiltration of lymphocytes. Okay, and then if in the brain, if you open those infected with avian encephalomyelitis, you'll see the cerebellum is congested, so become reddened in color. Okay, this one here, encephalomyelitis, neuronal degeneration. This is the nerve. Okay, you can see the brain area. Okay, prevascular cuffing. Prevascular cuffing is like at the vessel here. It's like infiltrate on lymphoid aggregates, lymphoid accumulations around the vessels. Okay, prevascular cuffing. Okay, again, prevascular cuffing. Inflammatory cells around the vessels. And then again, neuronal degeneration. If you see at the nerve here, it doesn't look good. So you see there's like all the white space, macam dah semua tu. This is the neuronal degeneration due to avian encephalomyelitis. And then, come in. Masih banyak tak? Alah, masa pergi ambil nanti pun tak apa. Okay, masih banyak kak. Tengah kelas ni. Tak apa. Sorry, interaction tadi Syamil Hakim. Okay, again, where am I? Okay, neuronal central chromatolysis. Okay, you Google out what does it mean. So you will see here the nerve has been pushed aside. The nerve the nucleus has been pushed aside here. Okay, this neuronal central chromatolysis. And then if you do postmortem of the gizzard, this is why they become whitish in color just now. They are like lymphoid aggregate is the muscle of the proventriculus. Okay, here, see all the lymphoid aggregates. Not proventriculus, it's ventriculus. Proventriculus yang sebelum gizzard tu, ventriculus is the gizzard. Okay, for diagnosis based on history, age, and sign, okay, you will see progressive ataxia, paralysis, and all those things. And and then look at the age, is around that very early stage of life. Okay, and then you also based on the history, if the breeder is vaccinated or not, if the breeder have sign of problem or anything before, something like that. Okay, and then you check on the microscopic lesion. Like I said, gross lesion, you don't see much except of the gizzard. So you check on the microscopic lesion. Swelling and chromatolysis of the neurons, infiltration and aggregation or lymphocyte in the muscular layer of the ventriculus, And you can also do immunofluorescent antibody techniques to detect the virus inside uh, ventriculars or in the brain. Okay. And serological tests, you can also do serology. Rising titers in sequential samples are highly suggestive of active infection. So what you do is you take several serology blood sample in like 1 week difference. Okay, so you check whether the titer is increasing. If the antibody keeps increasing, man, it means the chicken are having an active. We have control against it. We have live and kill vaccines is available. Control of AE is achieved by vaccination of the breeder flocks. Maternal antibody protects progeny for the first 2 to 3 weeks of life. So you don't vaccinate the broiler, you vaccinate the breeder. Okay, prior to the egg production. It can be used in egg layers as well to prevent temporary drop in egg production associated with AE. Okay, so selalunya breeder, tapi layers pun they can get infected. But if you want to prevent the layer from having that drop in production, okay, the transient drop in production, you can also vaccinate the layers. Okay. Live embryonated propagated virus can be given through water, spray, or wing web. This is one of the virus or one of the vaccine that can be given through wing web. There's several vaccine that can be given through wing web. Number one is smallpox. Number two is avian encephalomyelitis, this one. And then last one is fall cholera. Fall cholera can also be given through wing web. So not that many vaccines that can be given through wing web. This is one of it. Okay. And then after you vaccinate them, and then the vaccine will spread. This is lifetime. It will spread within the flocks. Vaccination in birds after 8 weeks of age and at least 4 weeks before the onset of the egg production. Okay, so it's controllable. It's something that's controllable. But if you don't control it, you might see. Okay, the next one is avian encephalomalacia. Okay, so don't be confused. Both are abbreviated as AE. Okay, AE. AE avian encephalomyelitis or AE avian encephalomalacia. Also, this avian encephalomalacia also known as crazy chick disease. Okay, chick je yang crazy ni sebab Dr. O pernah complain kat saya hari tu. Dia kata ada student jawab crazy pig disease. Where did they heard from? Oh, I think probably from they confused with avian medicine then. Because only chicken get crazy. We have crazy chick disease. And then don't answer in swine medicine, crazy pig disease. Okay? It's a vitamin E deficiency. It is a nutritional issue. It's due to vitamin E deficiency. Vitamin E and selenium containing enzyme prevent cell membrane disruption by peroxidase and other oxidants. So vitamin E, one of the important function of vitamin E is it works as antioxidants. Okay, if you are lack of vitamin E, tu nanti. Okay, vitamin E, selenium, and sulfur containing amino acids that works together. Usually seen in young chicks or turkey poults. Okay, usually birds in confinement. Because bird in confinement, they cannot scavenge for foods. Okay, they boleh tak boleh cari. They have to eat. They have to eat whatever was given to them. Okay, vitamin E deficiency usually commonly seen also in pet birds as well. Okay, because if the food that was given is insufficient of vitamin E, then you might see, or in layer or in fish animal. Okay, so most outbreak happen in birds fed with high polyunsaturated fats. Why high polyunsaturated fats is bad? Because polyunsaturated fat can somehow destroy vitamin E in the diet, okay, in the food lah. Ataupun rancid food also can destroy the vitamin E. So there are 3 main clinical signs or manifestation of vitamin E deficiency. Although it's known as encephalomalacia, but actually there's three distinct manifestation. Number 1 is encephalomalacia. Number 2 is exudative diathesis. Number 3 is muscular dystrophy. So if the bird is lacking vitamin E, so they can lead to these 3 issues. Number 1 is encephalomalacia, hence the name. It can lead to ataxia, loss of balance, falling over backwards while flapping the wings. Itu baliknya tu berarti. Okay. prostration with leg outstretched, head retraction, and torticollis usually begins between 15 to 30 days old and can be late as 56 days old. Okay, so this one is the neurological sign. And then the next one is exudative diathesis. Okay, lack of vitamin E can also leads to increased capillary permeability. And then if you have capillary permeability, your blood vessel permeability is not so good. Okay, so all the fluids goes out from your blood. Okay, and leads to generalized edema. Red, black, or blue-black gelatinous subcutaneous edema in abdominal and thoracic region. So you see a lot of fluids in the abdominal and thoracic region, and leads to difficulty in walking and stand with leg apart. Because perut dia dah penuh dengan air ni, okay, ascites macam tu. So dia orang pun kaki pun terbuka, dia buka pun. Okay, so in addition plus tu dia ada neurological sign. And then the last one is muscular dystrophy. Okay, which leads to locomotor disorder. This can also cause dystrophy of the muscle, okay? Abnormal growth of the muscle. Okay, this is how they look like. Encephalomalacia, dia terbalik ke belakang, okay, and then flattening. Okay. And then or they just prostration and they legs stretch. This is how they was it. Okay, prostration with leg outstretched. Okay. Kejangnya tu, lepas tu kaki bawah. Okay, and ni pun sama, torticollis, and then so those are the clinical signs. There's not much clinical sign except other than neurological signs. But if you do postmortem, what do you expect to see for encephalomalacia? You will expect to see the cerebellum become swollen and contains yellow or congested hemorrhagic or necrotic areas visible on the surface. Okay, sama macam encephalomyelitis just now. The cerebellum can become congested or hemorrhagic. Now, the second one, for the exudative diathesis, if you open up the chickens, you will see blood-stained viscous edema in the skin, okay, and distension of pericardium with fluids. Dekat heart kan ada yang sac tu, and then the sac tu is filled with fluids, okay, and then the body is also full with edema. And then the last one is muscular dystrophy, white streaks on pectoral and leg muscle dekat dia punya pectoral muscle dada dia tu yang nampak putih-putih, dia macam stripe putih. Okay, and then dekat kaki dia pun sekali lah. And then the gizzard, the gray area of muscle degeneration. Okay, so this is how it look like. Encephalomalacia. Okay, slight discoloration or congestion and hemorrhages of the cerebellum. And the blood become yellowish. Okay, see, encephalomalacia, discoloration. Okay, and then this the exudative diathesis look like. Okay, this is the chicken, this is the breast, okay, this is the thigh, kaki dia tu dah koyak kat sini, and then underneath here that's filled with yellowish, reddened, viscous color fluid. Okay, macam dia macam consistency tu dah macam mucus, macam kat. Okay, and the pericardium, this is the heart, pericardium distended with fluids. Okay, the heart is inside, the pericardium is distended with fluids. This is how they look like on the muscle. Degeneration of the muscle fibers, you see muscle streaks. Okay, white streaks on the muscle. And then this is the gizzard. Okay, this is a normal gizzard. This is the affected gizzard. Because gizzard also, the wall of the gizzard also consists of muscle. Muscular dystrophy of the gizzard cause whitish discoloration of the gizzard. Okay, so like I said just now, avian encephalomyelitis can also cause discoloration of the gizzard. Okay, but due to different reasons. Encephalomyelitis just now, the discoloration of the gizzard due to infiltration of the white blood cell lymphocytes. Okay, but for avian encephalomalacia, discoloration of the gizzard is due to muscular dystrophy. Okay, so if you see whitish discoloration, so you have to differentiate these two, do histology. Okay, if whether the inside one is full of lymphocytes or not, infiltration of the inflammatory cells. Okay, kalau tak, is due to muscular dystrophy. Diagnosis usually made based on the clinical signs, gross and microscopic lesions. So like I said just now, okay, the gross lesions you tengok putih-putih, sana putih, sini putih, and then all the fluids inside there. So it's very suggestive of the avian encephalomalacia. And then if you want to test further also, you can also test your food, okay, send the food content, whether it's insufficient of vitamin C or something. Okay. The control, you have to give vitamin E supplement and addition of selenium in feeds and drinking water. If you want to give treatment, immediate treatment, you give addition of vitamin E in. So this is a nutritional issue. So fix the nutrition problem, then you will fix the issue. Okay. That's the next one. Just now is vitamin E deficiency. Another one is vitamin A deficiency. Vitamin A functions is for vision, integrity of mucous membrane, maintain cerebrospinal fluid pressure, growth and reproduction, as well as antioxidants. Okay. Deficiency of vitamin A will lead to epithelial metaplasia. Mucus secreting cells become keratinized. Okay, so your body have a lot of mucus secreting cells. Okay, all the goblet cells. Okay, yang keluarkan mucus hidung, telinga, dekat hidung, on the nose, on the nasal area, in the esophagus. Okay, and throughout your intestine also, you have some mucus secreting cells. Okay, so those are the places: conjunctiva, nasal sinus, esophagus, and trachea. And gaseous material in the eye, nasal sinuses, white yellow pustules in the esophagus or trachea, and bone growth might be affected as well. In adults, what you see is reduced in egg production and hatchability, watery discharge, eyes in the nostril, and eyes stuck together, white gaseous exudate. So like the eye contains the mucus secreting cell. That's why you can produce tears and whatnot, mucus and okay, the conjunctiva semua tu. So when the epithelia of the eye or trachea everything become keratinized, okay, they become thickened. Okay, and then the eye will become stuck together because a lot of gaseous material are stuck together. And the cheeks sign might appear in 1 to 7 weeks, depends on the amount of vitamin A stored in eggs and feeds, anorexia, growth retardation, and drowsiness and ataxia. Birds usually die before develop eye lesions, but if they survive, inflamed eyelids and cheesy-like materials in eyes and nostrils. In postmortem, okay, it is quite very highly suggestive lah. I have seen this a lot also in pet birds as well. Okay, like I said just now, cage birds, sometimes if the food was given to them is insufficient of vitamins, and then you might develop this kind of thing. Small white lesions resembling pustules, okay, on the nasal passage, mouth, esophagus, pharynx, and the crop. And some of them will develop into ulcers and leads to secondary infections. If you do histology microscopically, original epithelium will replaced by keratinizing epithelium. Squamous cell metaplasia. Tahu kan ni semua ni histology apa semua ni. You should know the histology of all the secreting cells, esophagus apa semua ni. Kalau tak nanti saya suruh Dr. Intan datang balik bambu. Okay, microscopically, original epithelium replaced by keratinizing epithelium, squamous cell metaplasia, ossicatory and glandular epithelium. It blocks the mucus, gland ducts, and glands become distended and necrotic. So, bila dia tebal ni, squamous cell metaplasia ni, kan kita ada glandular cells yang produce secret apa semua tu. Sebelum dia become thicker, it close the glandular gland. Okay, and then the gland tu tak boleh keluarkan dia punya secretion, so dia mengembang dan bengkak. Okay, in chronic cases, postmortem lesion, you see accumulation of urates in renal tubule as well, because your tubules also are secreting cells. Deposition of urates on the heart, pericardium, liver, and spleen. Bilateral swelling of the face. Accumulation of exudate in the sinus, because your sinus also are mucus secreting cells line up. Trachea and bronchi was covered with fine films, the whitish. This has like the swollen of the face ni in chronic cases, mata dia dah jadi keluar yang putih, whitish pustules. If you look at the trachea in the esophagus here, if you look closely in the esophagus, nampak tak yang biji-biji putih? Okay, all the whitish dots there. I have a much clearer picture in my phone of the real case I've seen years back. Yang tu saya tak dalam exam je lah. Okay, and then this one is the crop area. Okay, you're not supposed to see all this white thing. Okay, dia macam white black head, white head ni. That's how they look like. Okay, if you do histology, kita gambar histology. If you do histology, you'll see the epithelium is thickened. Okay, like the glandular structure is like blocked like that. Okay, if you open the mouth of birds, pet birds also. Okay, if you open the mouth and you see whitish gaseous material in the mouth, there's several differential diagnosis. Okay, take notes on this. Number one is fallpox, because I've taught you before, fallpox can have the wet form. The wet form become the white gaseous material in the mouth. Number two is vitamin A deficiency. Okay. Number three is candidiasis. Candidiasis is a fungus issue. Okay, if you're giving them like pet food, something they can candida, the fungal can grow. Okay, in the crop, suddenly they extend until the oral cavity. And number four is mainly very common for pigeons. Okay, is trichomoniasis, Trichomonas gallinae. Okay, please take note. If you see whitish lesions in the mouth, these are your four differentials. So diagnosis based on clinical signs and lesions. Treatments, you have addition of vitamin A in drinking water, and prevention, you can provide again vitamin A in drinking water and avoid storing feed for too long. Okay, because rancid food can destroy vitamin A. This is number one. Satu slide saya nak cover dua lecture ni. Sebelum tu saya nak tunjuk gambar. Okay, yang ni gambar tadi ni. Okay. And then if you open the crop, okay, this is what it look like. Okay. Putih ni. And then if you do histology, this is how they look like. You'll see how thickened is this. It become, like I said just now, it become keratinized. Squamous cell metaplasia, the overgrown of this. And then this is the glandular structure. If they become thickened like this, it blocks the opening of the secretion. So secretion ni tak boleh keluar. So that's why the accumulated, it become like all the glandular structure, all the gland here become like crusty, and because it blocks the production of the secretion. Macam ni lah, the fully closed, nampak tak? Secretion tu tak boleh keluar, semua dia kembang. Okay, so this one. Okay. I didn't put in lecture notes, so those 91 people only see this picture. Okay, I have another lecture I need to finish on. Let's go to the second one. Okay, next one. Marek's disease, aflatoxicosis, and botulism. These are the neurological disease that can cause neurological signs. Number one is Marek's disease. Another one is Marek's disease. This is my favorite disease also, because this is my PhD. Okay, my PhD was in Marek's disease. I infected a lot of chicken, thousands of chicken with Marek's disease. Okay. It's a lymphoproliferative disease resulting in the formation of malignant T-cell lymphoma. Okay, what is lymphoma? Then we should. Okay, tengah ambil CP sekarang. You are taking CP and then you have taken pathology. So you should know how to differentiate cell cancer. Okay, there are different type of cancer, carcinoma, apa semua. Maksudnya lymphoma is one of it. How to do see lymphoma under the microscope, apa semua tu. You can refer to Dr. Azalia punya lecture notes or his IG. Okay. And then Marek's disease is a lymphoproliferative disease resulting in the formation of malignant T-cell lymphoma. It's highly ubiquitous. Highly ubiquitous in a way is everywhere. Okay, easily infected. and hard to control also. If in US, they're saying that the moment you put your chicken in the farm, they might be infected with Marek disease. Okay, because Marek disease is quite unique. They spread through dust. Okay, any farm should have dust, and then they survive very long in the dust. Okay, so that's why it's very difficult in US situation. In Malaysia situation, nanti I cerita balik. It's highly contagious also. You get infected, chicken get infected, and then everybody get infected. Okay, no public health significance. The chicken might be very ugly because they are like developing tumors everywhere. Nice lesions, okay, nice lesions, ugly chicken, but you can eat the chicken. No public health significance. It can only infect the chickens. It's controlled effectively with current vaccination program. Okay, there is a vaccine against Marek disease. Like I said in the previous lecture during the vaccination, Marek disease vaccine, okay, is the first vaccine that can control tumor. Okay, in any species. Okay, they prevent the development of tumor. Kalau in human, you should, okay, hopefully if you haven't, you should take the HPV vaccine. Okay, human papilloma virus vaccine, especially for the girls. Okay, especially for the girls. Saya cakap Google, pun saya pergi Google pula. Okay, I say with the girl HPV because it can lead to development of cancer as well. Guys pun should have HPV vaccine juga. It can also infect guys as well. Okay. The etiology of this one is herpes virus. It's a Halpa herpes virinae, subfamily of herpes virinae. MDV genome is very similar in structure of human herpes simplex virus, alpha herpes virus. However, it infects lymphocyte like Epstein-Barr virus. Okay. Kita tak payah hafal lah benda ni. It's just interesting facts, okay, about the Marek disease, how unique it is. It's a complex disease. Highly cell associated. Okay, what does it mean by highly cell associated is the virus can only survive in cells. Okay, they cannot survive outside cells. So it's this is one of the vaccine. Okay, the vaccine has to be stored in liquid nitrogen. Okay, but the vaccine to all the viral disease vaccine basically in life. Okay, and then they have to make sure the cell is alive. Kalau letak dalam peti sejuk biasa, sel tu mati. Okay, it have to be in liquid nitrogen all the time. Okay, the alpha herpes virus can be divided into serotype 1, serotype 2, and serotype 3. Divided in serotype 2 and serotype 3 cannot cause tumor, but they are used to develop vaccine. The serotype 1 is the one can produce tumor because they have this gene called oncogene. Okay, MED gene, call it. Okay. And then the serotype 1 can divide it into petotypes. Okay, like I've mentioned in the previous class, the definition of petotype, the virulence is different. Okay, so the petotype can divide it into mild, virulent, very virulent, and very virulent plus. The Marek disease can only infect chickens, is the natural host, and also infect chicken, quails, turkey, and peasants are also susceptible to virus infections and disease. The transmission is through lateral transmission, direct or indirect contact between birds, contaminated environment. Replication of fully infectious virus is the epithelial cell of feather follicles in the dander. Okay, how the virus spread to other is the virus was shedding through the feather. Dia bukan through air ataupun tahi apa semua tu, dia shed through feather. The virus tu keluar ikut feather follicle. Okay, dust yang keluar daripada bulu tu contains the virus. Okay, and then once the chicken get infected, they will shed the virus for the rest of the life. Okay, even though they survive the virus, tapi the virus can be shed throughout their life. Okay, sampai dia ketua, selagi dia ada bulu lah. And then the transmission can also through arthropods, duckling beetles, and can passively carry the virus. There is no vertical transmission. Okay, dia tak boleh infect from mak ke anak. I have question just now. Someone tanya, why not broilers? Soalan dekat mana ni?
It's for avian encephalitis.
Avian encephalomyelitis? Why not
Yeah.
broilers? What do you mean why not?
Yeah. Why not broilers are vaccinated also? I mean, since it infects younger birds.
Oh, okay. For this one, the vaccination usually is for breeders because the development of avian encephalitis is very early in life. Okay, if you want to vaccinate the chickens, the broiler, you have to vaccinate like the day old, and then it might have interference with antibody or something. Sometimes sebab dia punya virus ni dapat daripada mak dia, okay, daripada parent. So what you have to do is you vaccinate the breeder, and then you have to protect the early life with using the maternal antibodies. Okay, and then like encephalomyelitis, they have sort of like age resistant. After they are older, it's not important anymore. They don't cause any much disease. So you vaccinate the breeders. So you protect the broiler. Got what I mean? Okay. Back to Marek disease. Okay, Marek disease can lead to two manifestations. Neoplastic, the lymphoma site, they develop the production of lymphoma throughout the body, anywhere in the body. And then the non-neoplastic can cause neurological syndrome, atherosclerosis, lymphodegenerative syndrome, and panophthalmia. And Marek disease is one of the disease classified as immunosuppressive disease. Okay, it's classified as immunosuppressive disease. This is the pathogenesis of the Marek disease. Okay, the feather dander, feather follicle epithelium, FFE, stands for feather follicle epithelium. Sorry. It goes into the lung, and then taken up by macrophages, and then it travel into the lymphoid organs, so the bursa mainly, and the thymus. Okay, and then in the bursa, it cause big first replication of the virus there. Okay, first replication in those are not vaccinated, they become early cytolytic infection of the B cells. The B cells in the bursa become atrophied because bila dia replicate kan, dia nak keluar pada virus daripada sel tu, dia break the cells. So it cause atrophy of the lymphoid B cells. Okay, after that, okay, it goes into the blood. And in the blood, okay, again, this is a herpes virus. One of the characteristics of herpes virus is the latency, similar to for ILT. They become latent in trigeminal ganglion, or in your, like I tell you story, chicken pox also become dormant in your nerve. Okay, herpes virus in Marek disease also can become latent, but they become latent in T cells in the blood. Okay, in the blood. And then after 21 days onwards, depends on the condition of the birds. If they are not vaccinated, the T cell, the virus can become reactivated. 21 days post-infection, become reactivated, and then cause development of lymphoma in any organs, skin, eyes, nervous system, and visceral organs. If the chicken are vaccinated, okay, if the chicken are vaccinated, it prevents the reactivation. So they maintain at dormant state, latency state. So the chicken still have virus, can shed the virus and whatnot. It's just that they cannot become reactivated to produce tumor. They prevent the development of tumor. Okay, incubation period is around 3 to 4 weeks. The clinical signs, general clinical sign is depression, dehydration, and blindness due to mononuclear infiltration of the eyes. Eye lose the ability to accommodate light intensity, and pupils will become small due to opening of the iris tu jadi tebal, dia tutup mata tadi. Macam saya cerita tadi lah. Okay, non-specific signs is weight loss, paleness, and anorexia. Early mortality syndrome. Okay, in some birds that infected, they can cause early mortality syndrome if infected with high virulence strain and death within 8 to 16 days post-infection. Dia ada ni, kalau you're infected with VV+, yang cakap tu, high virulent one tu, and the chickens are not vaccinated, okay, it can cause early mortality syndrome. Many birds will just die within 8 to 16 days post-infections. Okay, and then the survivor will survive and develop tumor later. Clinical signs, neuronal involvement will be seen around 3 weeks of age and peak between 2 to 7 months. Asymmetric progressive paresis, later complete paralysis of one or more extremities. Wing involvement, you'll see drooping of the wings. Okay, kalau dekat nerve, if affect the nerve, uh, the lymphoma affecting the nerve, okay, of the brachial nerve, okay, of the brachial nerve, so the birds cannot put on the wing, the wing pun jatuh. And in coordination of tilted gait, if it affecting the sciatic nerve, then the bird won't be able to walk, okay, and the stretching of one leg forward, unilateral paralysis or paralysis. This is how they look like. Ni ayam ni dua ni sama age, same age. Okay, you see the uniformity issue. Those that are not infected is bigger. This is infected. It's much smaller. They didn't grow. And then they just like ruffled feather. This is how they look like. The typical clinical signs of Marek disease. One leg stretching out like that. Okay, unilateral. Okay, this is how the eye look like. Okay, this is not a normal eye. You see the white thing here. Okay, this is actually tumor, lymphocyte accumulation. Okay, lymphoma. This is a normal eye. Okay, your iris is like this, pupil opening, the lens kat tengah ni. Okay, and then in Marek's disease, the lymphocytes infiltrate the iris. Okay, dia grow kat sini sampai kadang-kadang sampai dia tutup habis. Okay, and in postmortem lesion, lymphoid tumors, lymphomatous lesions in the gonad, in everywhere lah. You can see lymphocytes, lymphomatous lesions everywhere in the visceral organs. Gonads, lung, heart, mesentery, kidney, liver, spleen, and whatnot. So basically all the organs. Because it spreads through the blood. As the kalau blood can run everywhere in the body. And then wherever it lands, it can produce lymphoma there. Okay. Lesions are similar to lymphoid Okay, I will teach you lymphoid under diseases that can cause tumor lesions. Okay, tumor disease. Okay, for now, but lesion is very similar. The enlargement of organs several times the normal size. Peripheral nerve lesion, if they are affected, you'll see plexus of the sciatic and brachial nerve. They are more enlarged than the respective organs. Usually it's unilateral. I'll show you a picture later. Peripheral nerve, loss of cross striation, gray or yellow discoloration, sometimes edematous in appearance. Lesions are often unilateral. Skin lesions is one of the characteristics of Marek disease, is distinct whitish nodules of feather follicles. Muscle lesions, nodular tumor of the muscles, ocular regions, changes is loss in pigmentation of the iris or the gray eye. So this is how they look like. Okay. This is the spleen, the proventriculus, the heart, the kidney. Okay, look at the kidney here. Like I show you in the previous picture, in the previous lecture, the kidney should be flat kat belakang tu kan. This is the kidney. Okay, enlarge the tumor. Okay, this is the testicle. Okay, and then this is the testicle. Left testicle is right testicle is okay. The left testicle is enlarged. So see how big the difference is. Like 10 times bigger. Okay, and then this one is the ovary. Okay, the ovary also. And then this is from my experiment, I think. The liver. Okay, if you compare with the liver, siapa yang suka makan hati tu. Okay. This is the liver. You can see the size of the liver here. It extends until the end of the abdomen. Liver sepatutnya separuh je kat sini. Sampai sini je. Liver should be half of the thing. And then you should see intestine around here. But you can see how big the liver is. It extends until the end here. Okay, and then do you see the tumor, all this tumor developing. And then this is the heart. Okay, ni pun tumor on the heart. But please don't be confused because heart pun ada fat patutnya. So you have to look closely and do histology. And if you look at the nerve, okay, this is the vagus nerve dekat neck. Vagus nerve, this is the nerve. Okay, this is the normal nerve. This is the affected nerve. Nampak tak enlargement here? Enlarge sikit ni. And then this is the brachial nerve. Brachial nerve dia patutnya size macam ni. Nampak tak dia ni? Dia macam enlarge kat sini. Okay, this is the sciatic nerve. Kat kaki. Okay, kat kaki. Sciatic nerve. This is the normal one. It look like this. This is the abnormal one. You see the lymphoma affecting the sciatic nerve. And then you might see also the loss of striation of the nerve as well. Okay. Alright, this is sciatic nerve. See enlarged in comparison with the opposite side. And then the leg also might see the reddening of the leg like this. This is called Alabama red legs. Alabama depends to referring to Alabama state. Alabama red leg. So lesions on the skin of the leg. And then they can also affecting the skin. Okay, see all the feather follicle here, semua dah buruk. So basically the ayam tu nampak bodoh lah. Okay, because of the tumor everywhere. Okay. Histopathology would be a great help for diagnosis also under the if you see under the microscope, there will be a mixture of pleomorphic lymphocytes and T lymphocytes, mononuclear infiltration of the iris. There are two types of the lesion in peripheral nerve, the type A lesions or type B lesions. Type A lesions are neoplastic, consisting of masses of proliferating lymphoblastic cells, so filled off with a lot of lymphocytes dalam nerve tu. Or type B, they are more inflammatory. They lebih kepada edema. Okay, they lebih kepada edema. So this is how they look like. Okay. So this is the type A filled with lymphocytes, or the lymphocyte lymphoma. Okay, if you look closely, then you see the malignancy of the lymphomas. Okay, this is the type B. Dia lebih kepada edema, nampak tak? Edema and then infiltration of the lymphocytes. Okay, this one also, this is under the skin, infiltration of the lymphocytes. Okay, lymphomas here. Bunyi. Okay, for diagnosis, you need careful consideration on the age, clinical sign, postmortem lesions, location of the organs affected, histology, and molecular techniques. Okay, again, because you need to differentiate with lymphoid leukosis. But I will cover later when we go into the diseases of tumor disease. For now, you just need to know about the general signs. Histology, you'll see mixed population of small to large lymphocytes, lymphoblasts, and plasma cells. You can also do immunofluorescence or immunohistochemistry. Serology have little value in diagnosis Marek disease. Okay, so you don't do serology to Marek disease. Like I said just now, it's highly ubiquitous. And infection does not mean disease. Infection does not mean disease. Sebab the chicken can get infected as early as possible. Okay, and then not all chicken can develop tumor. Marek disease are only called Marek disease if they develop the tumor. If not, it's just Marek disease virus infection. Infection does not mean disease. It's like your herpes virus, your chicken pox. You get infected, and then when you are developing all the biji-biji tu, you are being called you having chicken pox. But after you recover, you still have the virus in your body. We are not calling you a chicken pox disease person, okay, for the rest of your life, kan, macam tu. So it's the same concept for Marek disease. So you don't call Marek disease, the chickens are not called having Marek disease until they develop tumor. Okay, they only have Marek disease virus infection. Okay, so serology have little value. If you do serology, they are most likely positive. Okay, the title will be there. So what you have to do is you have to do real-time PCR. Okay, real-time PCR. Prevention and control, we have vaccination against it. We can use vaccination. Vaccination against Marek disease are given at day old, intramuscularly or subcutaneously. This is one of the disease the vaccine can be given through embryo. Okay, at 18 days old embryo, inject into the eggs. Okay, this will reduce labor if you use machine. So kalau ayam, kalau seorang-seorang sakat tu nak kena guna orang. Kalau telur ni masuk mesin je. Okay, the vaccine, okay, you have to know this. There are only like 3 vaccines available: HVT plus SB1, and CVI 988, which is the wristbands. Another name is called wristband. Okay, HVT was developed from serotype 3. HVT plus SB1 was developed from serotype 2 and 3. CVI 988 was developed from serotype 1 virus. So serotype 1 also known as. Saya punya lecture memang sampai ke sebelah. Okay, next one is aflatoxicosis. Are you familiar with Marek diseases? Okay, next one is aflatoxicosis due to mycoplasma. Mycotoxin. I will invite another lecturer from the field to give you a lecture on mycotoxin in general. There's a lot of mycotoxin out there. Okay, so there's a lot of mycotoxin out there, and they always produce a lot of problem in chickens as well, because due to feed storage, feed quality, and whatnot. Okay,
So for this lecture, it's just on aflatoxicosis. It's caused by toxic fungal metabolites, the mycotoxin. It's one of the diseases that can induce immunosuppression. It's highly toxic and carcinogenic, and it's toxic for B lymphocyte in late stage of embryo. So that's why it's immunosuppression, because it causes destruction of the B lymphocytes. The etiology, okay, is mycotoxin produced by Aspergillus species known as aflatoxin. The Aspergillus that can produce aflatoxin is Aspergillus flavus, Aspergillus parasiticus, and Penicillium tuberculum. Okay. Poultry feeds and ingredients are vulnerable to fungal growth and aflatoxin formation. If you keep your food for too long, and then the fungal will grow and then lead to production of. Clinical signs you see in appetence, reduced growth and abnormal vocalization, and feather picking, purple discoloration of the legs, feet, and lameness, ataxia, convulsion, and opisthotonus. Liver and kidney look enlarged and pale. In chronic case, ascites and hydropericardium, shrunken firm nodular liver, and distended and hemorrhages of the gallbladder. And basa of fabricious, thymus, and spleen will look atrophied as well. So this is how they look like. Okay, ni ayam yang normal, ni ayam yang affected with the aflatoxin. The liver become tan in color. Okay, the coloration of the liver. Histopathology, fatty changes in the hepatocytes, proliferation of the bile ducts, and extensive fibrosis. Pancreas and kidneys, you'll see degenerative lesions on the pancreas and the kidneys. For diagnosis is you can do isolation of the fungus. You take the feed and do isolation. Identification and quantification of the specific toxin from the feed samples as well. Okay, ada several lab yang buat mycotoxin analysis. Okay, you can send the feed sample if you suspect they have mycotoxin issue. The treatment, remove toxic feed and replace with unadulterated feeds. Good feed manufacturing and management practices will prevent mold growth and mycotoxin formation. So that's all on mycotoxin. The last one, okay, for the lecture today is botulism. Okay, botulism is quite common in tropical country also. Okay, this is a major problem in wild ducks back then lah. Okay, it also affects all domestic avian species. The problem caused by a powerful toxin, which is the botulinum toxin. Korang tahu kan botulinum toxin tu yang buat botox tu. Inject untuk botox tu, yang suka inject botox tu, itu same toxin lah yang cause this issue. Okay, infection are not present in infected birds. Okay, usually it's not because the chicken are infected with the bacteria producing the toxin, but it's because they consume the toxin. Okay, condition for chickens or for avian is referred to limber neck, because the neck become lembut. Okay, causative agent, exotoxin produced by bacterium Clostridium botulinum. There are two types, type A and type C, usually seen in the domestic birds. Okay, and there are banyak types, tapi type A and type C usually seen in the domestic birds. Okay, they also known as Western duck sickness in US. Sebab sebelum ni dia pernah cause duck issue in US, is caused by type C. Clostridium botulinum is a large, gram, positive spore-forming rod that grows anaerobically. So basically, untuk ni the virus and the bacteria grow in anaerobic condition, that animal. 0.00012 milligram of toxin can kill adult guinea pigs. I don't know how much they inject into the botox. Orang inject botox tu berapa milligram. Okay, incubation period 24 to 48 hours after toxin is consumed. Cause of disease is acutely affected birds seldom survive. In mild cases, birds may recover in 2 to 3 days. Mortality, it depends. Okay, kalau if the bird consume high amount of the toxin, then you will see high. If the only certain bird are affected and consuming the toxin, then you will see a low mortality. So it depends. Kalau banyak-banyak tu dia mati berjemaah lah. Okay, the method of spread in chicken and peasants in backyard flocks and floor layers due to decomposing dead animals and fly. So that's why if you have a dead animals, apa semua tu, you have to remove it immediately. If your farm have mycotoxin, botulinum in the environment, then the bacteria can grow in the dead animal. Okay, this is the method of spreads. Before this, ni you tak payah hafal tak apa benda ni. Okay, ni waktu when it happens in Western dark sickness. Shallow alkaline lakes with high content of botulism in the mud, okay, because leads to decay of vegetation around the lake, okay, will leads to the anaerobic conditions, and then the anaerobic conditions will leads to insect and larva die, okay, and then the larva contaminated also with botulism. Lepas tu kat situ pula ada banyak ETAs tu. And then all the ducks ingesting the larvae. Kena ambil dia macam nampak worm. Oh, food banyak. Okay, and then the ducks die due to botulinum toxin. And then the duck died, and then blowflies come in. Okay, and then the flies die in the water also. And then the kawan-kawan yang duck yang lain tu, makanan baru. So dia makan pula. Okay, ingested by ducks. So, and then the cycle continues, perpetuation of the outbreak. As long as you don't remove the duck or the larvae, and then this is what happened before in Western duck sickness. So clinical signs: dullness, leg weakness, and progressive paralysis. Complete paralysis of neck and wing muscles. So the head will rest on the ground, the neck is extended. That's why it's called limber neck. Dia tak boleh angkat kepala dia, sembit sangat. So dia resting all the kepala dia kat lantai. Okay. Paralysis will lead to coma and death. Feather become loose and easily plucked. This is how the limber neck. Dia pegang kepala dia, dia angkat kepala dia. Even in human also, I think in human can also be infected with botulism. That's why you don't, but you require quite a big amount of toxin lah. Okay, botulism toxin to have the issue in humans. But this is one of the reason why you shouldn't give honey to babies. Okay, we call it the infant botulinum. Because sometimes in the honey there are botulinum toxin. Because baby kan dia kecil kan, so the body weight they only need less amount of toxin compared to adults. You shouldn't give honey. You can Google lah. Infant botulinum kind of is due to honey or something. Okay. Postmortem lesions. If you do postmortem for chickens, there is no diagnostic lesions. Okay, semua orang just mati berjemaah macam tu je. And then you buka postmortem, the postmortem doesn't show anything. They just die because it's very acute. Okay. So for that, other than the clinical signs lah, or the neurological sign, limber neck, whatnot. But if we do postmortem, they don't show anything. So if you want to do postmortem diagnosis, you have to demonstrate the presence of the toxin. You can intraperitoneal inoculation of susceptible mice with serum or feed material from crop and intestine to susceptible mice. Control mice will be protected. Control mice protected with anti-serums should also be inoculated. So dia akan inject dua group of mice lah. Satu ada anti-serum against botulinum, satu tu tak ada. Kalau injected with the serum taken from chicken into the mice, there's the with anti-serum survive, and those without anti-serum didn't survive, then it's due to botulinum. Okay, suggestive is usually good enough, so you don't actually have to demonstrate so much. You nampak limber neck, lepas tu it's good enough to make based on the typical syndromes. Okay, treatments. Treating visibly affected bird is of little value. Yang dah makan apa semua tu tak boleh buat apa dah tadinya. Okay, nothing much you can do. Okay, just let them do. Epsom salt in the feed 1 pound per 75 to 100 birds for 4 to 8 hours. Okay, so if I'm not mistaken, to neutralize or something. Molasses in the water 1 pound per 5 gallon for 1 day. Molasses ni apa, gula merah. In broiler house with history of botulinum problem, you can treat with antibiotics which are effective against gram-positive bacteria such as bacteriacin as soon as the diarrhea develops. Selenium can also help the problem. For valuable birds, because selenium is for the nerve. For valuable birds, you may use specific antitoxin 2 to 4 ml in large ducks. Tapi I'm not sure whether in Malaysia ni, not in vet field lah. Okay, we don't have anti-serum for antitoxin for botulism. I think in human side, maybe they have. Prevention, feed fresh wholesome ratio. Jangan bagi makanan yang dah lama dah buat semua tu. Make sure all dead birds are removed from pens each day. Don't allow the virus, the bacteria to grow in the dead birds. Antibiotics in broiler might be able to control it, and vaccinate valuable bird with 2 injection of type A and type C toxoid 3 to 4 weeks apart. Okay, ni yang kalau burung-burung mahal lah. Tapi this one also we don't practice in Malaysia. Okay. Malaysia also, I've never seen botulinum case in Malaysia, but it could happen. Prevention in broiler house, clean out affected house, put in new litter and acidifying soil and litter in affected houses using sulfur. Because these bacteria usually grow in alkaline situation. Okay, I think that's all for today. Any question on anything on today's topic? Okay, anything?
Doctor,
Yes.
I'm just wondering, because you said to acidify the soil and litter in affected houses, for the duck farming, right? For example, if it's infected because they are in open space, so how do we decontaminate it?
For what?
For the in duck farming.
In duck farming, usually if you know in duck farming kan selalunya kita lead in open space kan. Okay, usually we'll have open area for them to swim lah apa semua tu. What you can do is you put in area around there lah. You spread sulfur before you bring in the ducks into your batch or something. You acidify the soil and everything.
Oh, just scatter the sulfur, something like that.
Yes. Lime.
Okay. Lime, all right. Thank you, Doctor.
Anything? Any other question? Okay, for your exam next week on Monday. Let's see, you want to include today's lecture or not? I haven't made the question yet. Yalah. Okay, so your exam is until last Monday punya lecture. Okay, so it covers until respiratory diseases. And then the format is going to be everything lah, from MCQ, short answer, essay, as well as images. It's not that difficult, it's quite easy. Okay, it's quite easy. Usually, not many fail. Okay, if you study lah. Okay, if you come to the class and listen. You didn't come because most of the thing is something that I said in the notes. Okay, I think that's all. See you next Monday. Please come early for the test. If you come late, because the first part of the test is gonna be images. I will show images first, and then you will answer based on the images. You datang lambat, you tak dapat tengok lah image tu dekat screen. Because the image will be projected on the screen. Okay, we will miss that part. Okay, please come early for the test and whatnot. Okay, that's all. Thank you very much. Have a good weekend. See you.
Doktor,
Saya.
the test dia start pukul 8 ke? Is it 1 hour test or 1 hour 30 minutes?
Standby by pukul 8. Pukul 8 tu patutnya semua dah ada lah.
Pukul 8 dah ada
Maybe saya start lambat sikit kot, 8 suku ke 8.30.
Okay, Doktor.
Padalah, I want to wait for everybody to be there. Okay, but please standby lah, pukul 8 tu dah ada lah. Okay.
Okay, Doktor. Thank you, Doktor.
Okay, thank you. See you guys. Have a good weekend.